These videos are learning materials for the London Enhancing Generalist Skills programme. They're related to the programme domains of social justice, person-centred care, systems working, population health and sustainability. In this video, Martin Griffiths and Roisin Keville focus on the human dimension of care and the personal values and attributes that contribute to creating a connected, moral service model.
So Martin, if I understand it, you're a consultant trauma surgeon at the Royal London and you treat a lot of gang-related violence. Is that right?
I think it was more just young people doing stuff to young people for the usual sort of poorly understood reasons. And I think we saw an awful lot of traumatized individuals, not just physically injured, but people who've been traumatized by a life experience, who had poor support around them and a lack of hope and a lack of access to support. So we could fix the injuries, but we never changed the narrative. So as individuals who are hugely vulnerable will go back to the community and be harmed or harm again.
We live in a society where there's not a lot of trust. Young people are not promoted and inspired much in our society, and especially certain pockets of our communities have a very, society has a very negative perception of them. There is a negative narrative that's been going for a very long time in our society that drives this negative perception of certain people in our communities. So when these young people present to GPs or present in REDs, following these incidences, or maybe just presenting to their GPs because, their mum has encouraged them to go because she's seen a difference, or they're not sleeping and they're struggling, how guarded they can be, how reluctant and how paranoid, and how rude and feisty. But what I think people on the front line in a clinical environment need to understand and remember the impact of trauma. And we all know that, yes, there's the physical, but the mental is long lasting. And this then impacts on how they present. So if you have a young person presenting in an ED department who's been stabbed, his face is all screwed up, his energy is all negative. He's not willing to engage. He doesn't want to chat to no one. He doesn't trust anyone. He's got 2 police officers at the end of his bed who he's not had a positive engagement with. Then he's got a doctor coming up or a nurse asking questions. And it's a bit overpowering, isn't it? Could you imagine if you've just been through a traumatic incident like that, and then all of a sudden you've got all these other things, all these strangers asking you questions, and if the approach isn't right, if the tone isn't right, if there is a non-judgmental approach and there's a level of kindness, that young person ain't going to engage with no clinician. And of course they're going to be rude, and there's going to be barriers. That's why I'll say as a disclosure, not literally, but you have to kill them with kindness.
Listening to you, Martin and Roisin, it seems to me that your purpose was about kind of saving these young people, about humanity, kindness, and about being brave and taking a risk, and not so much about ticking boxes and checklists. Feels like illness wasn't the center of this; it was wellness.
100%. Because how do you affect change in a person if they're not, if they're not working on all throttles, if there's elements that are missing, if they've got a lot going on, and there's all these negative influences or negative life experiences, and none of us know everything. We're all learning. Some of us may be at the top of our game to a certain degree, but let's face it, there's always something to learn, isn't there? And it's about understanding that young people are also learning, but there's an element where in society, they're 18. They're 18, so that's it. They're adults, they know right from wrong, and, that's it. I've said so many times, I'm like a broken record. Is it any surprise we're here? Is there any surprise we're here right now with this young person who's been stabbed, who's been shot, who's not even 18, who's doing county lines, when we look at his historical failures and the neglect that he has suffered as a child into, becoming a toddler, into a young person, and now as a teenager. This particular one I was just mentioned, he was 16 and he was shot in the abdomen. He came back just as I was coming back from maternity leave. He came back 2 years later being stabbed again.
Now, I think when you see people who are the victims of terrible social circumstances, being violent, victims of violence, there's a kind of feels sometimes like it's all inevitable and hopeless. So I'm really struck that you had the imagination and I think the bravery to challenge that and to think, things could be different for these boys.
When they meet clinicians and they meet law enforcement, they meet social services, they meet people in fixed boxes. When they meet Roisin and Samir and Munir and those guys, they meet people who, when they disclose their own backstories, are different. And those young people can see that you can have difficult circumstances, challenging experiences, poor outcomes in youth, and still be successful and still be respected by clinicians, still be effective. So there is a pathway to success and integrity. Maintain your integrity and retain your true self, and you can work and be effective in a healthcare environment. And that's a real important thing to see for it as a young person. They can affect change and behavioural change. People who weren't talking, young boys who would never talk to anybody would be openly weeping in their arms, sharing their pieces around that. And that level of intimacy and transparency doesn't come from a place of incompetence. It comes from a place of real skill and real professionalism, and that engendered such respect in our staff. Well, I think you've got to feel it as well. It's all very well having bits around, but when you can feel that connection, you can feel that positivity. It's easy to bring a bit more of yourself to the party. You don't have to be that sort of stiff little clinician working in that little box. You can actually say, how are you feeling about that, and talk about someone's trainings, whatever it is, and actually bring and live just that one life. You can't be there isn't the home Martin and the work Martin and the supermarket driving Martin. They're one person, and that living that true one authentic life. That's about the hospital without walls. Isn't just about the box. It's about the prison you make for yourself and your behaviours. That you keep on conforming to a stereotype of behaviour you think is right for that environment, and you change when you're in work, when you're in the car, when you're in the clinic. And that's not right. That isn't good for you as a clinician or you as a person, because you're living false lives. But when you can be authentic in all those spaces and you see what authentic looks like and that it's still effective, it's incredible. And it's a diverse group. It's not just tall, short, long, that. It's every possible protected characteristic, for one better phrase, is represented and respected. So it's about your ability, not who you look like, and not how you sound like as well. So there are different accents. People are not being quite so plummy anymore. They're being a bit more real with their own voices because they can feel comfortable in that space. If you don't want to listen to the whole truth, get the whole spectrum of emotion that person brings to the table, you're never going to be the clinician you need to be. Because you need to understand that injury that person received is just part of that story. All those missteps in their life, all those abuse they've had in their past, all those things all those engaging with authority and left them not trusting authority has led to this point. That's the reason that person won't listen to you, won't look you in the eye, won't offer a solution, will be evasive, will be openly rude, because they're screaming for help, but they're screaming at you. You've got to recognise that for what it is. And it takes a piece of you to recognise that and see it for what it is, for you to be truly authentic in that moment. And it's not easy, and it's not for everybody, and it's not forever, because you can't do this forever, because you have to take this learning and use it to something more positive. And I would say, rather than it being a burden for you to carry, it's a load of learning you can take and you can integrate into your practice, and you can move on with it. Because I want everybody to work who's exposed to this practice to take it somewhere else and take their own model and make it and disseminate it somewhere else. Because this piece of working, this environment we've created, this ecosystem we've created, is supportive, it's inclusive, it's incredible, it's universally positive. We do our best for that individual, no matter what. We won't give up on you because your heart stopped beating. If you're in theatre, we won't give up on you just because you just said no 2 or 3 times. We won't give up on you because you've had a hard time in before, because you've got an ankle tag on. We're not going to give up on you just because circumstances are adverse. We live in adversity. Everything we do starts off badly. No one comes to me saying, "Oh, it's trauma time, happy days." It's always, "I've been shot, I've been stabbed, I've been run over, I've been hurt. I'm unreachable. No one wants me. No one cares about me. My parents won't talk to me." And yet, we still engage with that individual. We'll still do our best to make you better. I don't care why you're here. The backstory to that bit isn't important. I'm going to provide the best care I can for you, and we'll work other stuff out later. So whatever it is, if you're a perpetrator or a victim, whatever there is, we will support your physical well-being, and then we'll buy into everything else there is, and we'll try and find out why. And if you're in prison, we'll work with you in prison. And we've built programs that sit aside from this, in a larger, wider NHS London context, to provide and support individuals in other spaces, because we know that it's effective. Because the most vulnerable people you'll find in, the criminal justice system, because they're the most vulnerable. Therefore, we have to support those as well. And I think that if we don't accept, what we can offer, the power we bring to the situation, and how people are literally crying out for help in those clinical environments, we fail as healthcare providers. And it's only through the work of the St Giles Team SOS Project that's shown us what good can look like. And that's why it's so important, because it teaches us all to be better people.
Everything's always evolving, isn't it? And the NHS has to continue to evolve with society and how things are changing. And your reference to the morale of it is more evident now, because it wasn't there before, but it changed, didn't it? And doctors started conversing and interacting with patients, and that stiff upper lip approach of clinicians, actually having a conversation with a patient was unheard of, wasn't it?
I'm not sure that we're still very good at having conversations with people. I know it's moved away from being that doctor-centered model where the doctor just tells you what to do. But I think that we often still have checklists in our head that are kind of buzzing around, and it sort of stops us from listening to the person in front of us.
It's all about throughput. And it's never about, and I think that it protects you rather than the patient. It's really interesting. So what you're talking about how can I not cock up? How can I make sure that I don't do things that are going to make me look like a fool? And how can I do this without getting too emotionally connected so I can get on the next one? If I can do those three things and then get them from A to B, I've done my job properly. But if I say to somebody, well, what do you do for a living? What do you used to do for a living? And they go, oh, I used to be this, that, and another. And you stop a little and talk a bit longer. You find that person had a career as an engineer, and they're intelligent, and they understand what plumbing's about. You can have a different kind of conversation. And the next time you speak to them, they go like, well, hello, Martin. And they go like, yeah, hi. It's a human system. We're working with people. You're not fixing the car. You're actually working with a human engine, and that engine's got feelings, and it needs to be respected. And if you don't give people their voice, someone doesn't say their piece and feel they've been heard in the communication. I have been heard. Just to give somebody the oxygen to share themselves and be heard is the first step to actually owning care. This is what I'm scared about. This is what I know. This is what I don't know. This is what I've been told. What do you know? And yeah, some people are very deterministic, want an up, down, left, and right answer, but most just want to be connected with somebody who actually cares about them. And we've forgotten about care in the health system. We've put in health. We've forgotten about care, and we don't care about.
Now, the problem is that you can't be a good clinician unless there's a two-way connection between you and the patient. And I think that's impossible unless you give something of yourself.
People need to trust. If you don't trust your doctor, your nurse, your therapist, your caseworker, you're not going to engage. You're not going to trust them to go into a scary space. I meet somebody for the first time with their guts hanging out, and I say to them, look, need an operation. They go like, well, who are you? I go like, oh, I'm the boss. And they look around and they go, well, he looks like he's the boss. Fair enough, he's the boss. Let's go for it. And we chat afterwards. But, if you don't have that sense of connectivity, it's something that good clinicians have. It isn't necessarily take a long time to do it, but that sense of openness and transparency and warmth and authority, people can key on that, yeah? And they key on that. But it isn't gained by book learning. It isn't gained by passing the exams. It's gained by actually engaging with people in a way that actually is positive, rather than prescribing care. Because that model of care might work for 85-year-old plus people, but young people want to be engaged and supported, and they're happy to challenge, and that's fine. And people, most clinicians, don't like the idea of being asked questions by patients. Like, why should I do that? I don't want that. That's not for me. I want to do that. Why can't I do that? And you go like, well, you can if you want to, but your head will fall off. And that's fine. How do you know? Well, because that's my job to know. Let's talk about why it's a good idea, why it's a bad idea. What are you worried about? Well, there's a lot of tablets. And okay, let's work it through. And you see, when you see Rasheen and the guys work with these young people, there's some proper pushback. I mean, I remember, I keep on saying, I remember telling this story to lots of people. I remember I was in the office once, this is early days, and Rasheen took a call from a young person who had missed an appointment with her, right? And she tore a strip off him. She gave him an absolute ripping on the phone. She was calling him all sorts and telling him what he was, what this and that, what she put into la 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 la. And what amazed me wasn't the language that she was using. Was that young person took it for 10 minutes, 10 minutes of absolute direct feedback from somebody he trusted. He didn't put the phone down, didn't walk away. He heard it all, and then he said sorry and moved on. That's the power of the connection that she had with that young person. That she could hold him to task, call him to account.
I guess you only shout like that if you care about someone. You shout like that with your kids, don't you? Not if you're not bothered.
Absolutely, but you don't listen to it if you don't have to. He could just easily put the phone down, yeah. But he wasn't remote. He could just fake the connection problem because he saw the connection, he saw the engagement, and that's what I'm talking about. You know, when you care, properly care, it shines through.
The bottom line is, yeah, I think I found my calling in it, so I ain't letting go of this pattern. And I want to affect change, and I want to make things better for young people. They have it so hard. Life is hard, and society is hard, and the system is hard, being polite on that matter. But yeah, so if I can do anything or encourage and support other people to help me or help the young people, I'm backing it 100%. So that's why I'm still here 7 years later.